Are you including these important questions in your patient health surveys? Capturing accurate patient data is a critical part of the healthcare process. Whether you run a doctor's office, hospital, or another type of healthcare facility, you need helpful patient health surveys. Not only do these questionnaires give you more background on patient health, but they also help you provide better care. I'm Noel, and in today's video, we'll discuss a few categories you should be including in your patient health surveys. Let's go. A successful questionnaire survey will enable your medical staff to have a better understanding of a patient's overall health, illness factors, viewpoint on provided healthcare services, and health-related risk factors. All of these are necessary to know to give the best patient care possible. When it comes to building your patient health survey, you'll want to keep these guidelines top of mind. You want a questionnaire that's valid, dependable, clear, brief, and engaging. Use these qualities as a framework when constructing your questionnaire. To make sure all of these qualities are hit, you'll want a well-designed survey. If it's easy to follow, you're more likely to gain helpful and complete information. Avoid using solely uppercase letters because they can be difficult to read. Number your questions and categorize them by topic. Use a mix of open and closed questions, and be sure to outline how answers will be analyzed. It's also helpful to provide your headings to make your survey easy to read. When building your own health survey questionnaire, be sure to include these important subjects. This one may seem obvious, but you'll want to collect your patient's contact information so your administrative team can reach them for follow-ups. Your contact information section should include first name, last name, phone number, alternate phone number if applicable, email address, and mailing address. Patient demographics can also provide you with more insight into your patient's health. Patient demographic information you should collect includes date of birth, gender, height, weight, racial or ethnic background, and language spoken. It's important to know who to contact if there's an emergency while a patient is in the care of your medical facility. This section is more for your administrative team, but having this info handy means they can contact a family member or close friend to provide them with up-to-date information. You should include spots for the emergency contact's first name, last name, phone number, alternative phone number, and their relationship to the patient. The next section will take up a good portion of your patient health survey, and this is the medical history section. Gathering medical history is imperative as it helps you understand the patient's current state of health and determine requirements for future care. This section can include mostly open-ended questions, so patients have room to describe their medical history in their own words. Alternatively, you could use a list of medical issues with checkboxes next to them. This way, patients select the issues they've had in the past, have currently, or have in their family history. Regardless of if you decide to go open-ended or a list of medical issues with checkboxes, it's a necessary section to include. If you want to go open-ended, here are a few questions you might want to include. How healthy do you consider yourself on a scale of 1 to 10, with 1 being unhealthy? Do you have any chronic illnesses? Do you have any hereditary diseases or conditions? How often do you have a physical examination? Another important section to include is the scenario-specific information portion. For example, if you're doing a wellness consultation, the wellness questionnaire may ask patients about their diet, stress levels, and alcohol consumption. Within this specific scenario, the info gathered can help you start a discussion that's already tailored to the patient's needs. The final section you'll want to include is space for patients' feedback. Connecting with patients post-visit can help you gather info about their experience with your practice. Try keeping this section short and straightforward so more patients are likely to answer this portion. Post-visit surveys aren't a common practice, so implementing one at your medical facility can make you stand out in a good way. Not only will you seem like you value excellent customer service, but you'll also gain some crucial insight. In fact, one survey showed that 80% of senior healthcare professionals said that appointments started on time, while only half of the patients agreed with that. Creating surveys including all of these important subjects is only part of the survey creation process. If you want patients to fill out your forms completely and in a timely manner, you have to set them up for success. And that means with a survey that's easy to understand and complete. This is where Jotform comes in. Jotform offers several health surveys and medical questionnaire templates. They're great for healthcare facilities as they can be made HIPAA compliant. You can work from scratch building your survey or customize any of these templates to get started. There's the COVID-19 screening questionnaire, the patient feedback form, the coronavirus case report, the patient medical history form, and the medical report form. You're ready to get started. You now know how to create healthcare questionnaires and understand which health survey questions to include. Remember, these health surveys provide you with more background on your patient's health and, in turn, help you provide better care. Let's review. Here are 6 question categories you should be including in your patient health surveys: contact information, demographic information, emergency contact information, medical history, scenario-specific information, and patient feedback. Until next time, I'm Noel with Jotform. Don't forget to subscribe to our channel to stay in the loop, and thanks for watching.